it's my pleasure to introduce Hwajung Choi, who's here from Michigan. She came to Michigan as a Fulbright scholar and has not left, and has gone on to now be, she got a PhD from Michigan in economics and is now a research assistant professor in both internal medicine and health management and policy. She does research on disability and cognitive impairment in middle and older adults, family care and spatial proximity, and combines both of them in this talk on family spatial proximity and implications for paid and unpaid healthcare. So take it away. Thank you.
Okay, thank you, Nama. Yeah, thank you, everyone, and I'm so pleased to be here and to share my some ongoing research and the recent studies as well on this topic. And so first part of my talk is about kind of introducing family network in a spatial context. So it will be more broader, sort of how the family, the spatial distance currently, and also life course perspective. And the second part, now, okay, so how the family spatial proximity, how it may influence the health care among older adults, especially older adults with limitations in daily activities and also dementia, okay? So let me start with some background here. So living in the same house or close by between parents and the adult children in the US is not unusual at all. It's very, I mean, probably more common than you may think. And the recent report by Pew Research Center, so you can see that actually the multi-generational living rate has increased really quite dramatically. And it had been decreasing until about 1970. And then it increased dramatically, as you can see that, and almost in terms of rate, about 7 or 8% in 1971, but now almost like 18%. So it's a kind of a very dramatic change. So, well, today we are talking about intergenerational proximity, and co-residence is one of the right extreme, the end of the proximity. So, geographic family proximity would have a really significant impact on people's lives, right? And for example, the intergenerational contact and especially in-person visits really influenced by where you live, how far you live from each other, and also, you know, child care by grandparents and also caring for aging parents. And some family support can be provided by remote places, but in-person care, especially hands-on care for like a child care or care for aging parents, it's really cannot be done by from the distance, right? So it's still very important. And one of the earlier paper, Liddell and Collis in 1987, and they actually looked at the rate of daily contact among older people who have a disability and their between them and their helpers, and it really dramatically decreases over actually, we are talking about block level, right? Block by block. So for example, it was about 85% the daily contact with the helper who lives on the same block, but the rate is like just 44% if they live just 2 to 5 blocks away. I'm not talking about miles, I'm sorry, just blocks away. And recently we also looked at, okay, so what about sort of recent, based on kind of relatively recent data and published early this year, and that is also true even now in terms of those who have disability, who need help, hands-on help on a kind of daily basis, then actually the care amount really dramatically decreases. Just the blocks or just 1 mile, and beyond 5 miles, actually not much happening after that. So it really depends on what context the close or far, right? Because 5 miles seems very close, but it might not be close enough. Okay. Okay, and of course, so based on these, we can imagine it may have really profound implications in terms of labor market outcomes, especially for women. Female labor force pretty much affected also whether they have, for example, the parents who can also help with the child care. And the migration decisions, of course, and whether to be close to their family members, the parents or children can be also very important part of a migration decision, right, preference. And of course, the caregiving, and not just the caregiving by informal care, like family themselves, but also it has a spillover effect on the formal care aspect as well. For example, it may delay. If you have adult children nearby or living with you, it may delay your transition to the nursing home. Okay, so let me share some national estimates of intergenerational spatial proximity, which has been done by me with my collaborators. Before that, some motivation. So what motivated us to work on this one? So these years, recent years, especially last, say, like 10 years, actually, we have really increasing evidence in the US about the intergenerational spatial distance, which is very good. But there are some aspects still lacking. So that, for example, first, the holistic approach, right? So pretty much a lot of studies are really focusing on distance to the nearest, especially when we think about aging parents and whether they have at least one child living within certain distance, because it's depending on right families. Some family have parents have only one child, but some may have like 8, and it has a huge limitation in some aspect if we focus only on closest. But there are some studies attempted to sort of take into account a more holistic approach. The Spring et al. In 2017 and Compton Pollack and Lynn and Rogerson studies, they also looked at including the nearest and the second nearest. They were also looking at kind of average rather than, but still it's not really complete in some aspect, right? And the second point is what about how detailed the information is? Okay, so as I said, 5 miles might be small, but it could be very big. So we really need, if we are really interested in the family care, the potential role of spatial proximity for caregiving and hands-on care, then we really need almost like a block. If not, at least a few blocks or less than like 1 mile. Right? This is a very small distance, but that's very important. And the studies kind of lack on this aspect. And as I showed earlier, the Lidwell and Coolidge 1987, they actually looked at, but the participants, they used not national level, focusing on people living in New York area and Florida area. Okay? And also the life course aspect. Actually, earlier studies, they talked a lot about life course perspectives. So theoretically and also kind of looking at some empirical, but not the full spectrum. So this is something, the empirical standpoint also, it has been sort of limited until recently. And what about the consideration of mortality? So we were talking about co-residence is the opposite, closest, right? What about the farthest? So it may be, okay, well, mortality is not a distance, right? It's, parents deceased, then well, it's not really distance. However, it becomes very important if we think about spatial availability. Distance is one thing, but if you want to add some the perspective or context of availability aspect. If you don't have a parent living, then right, it's really the farthest in a way. So we want to incorporate also this mortality aspect in this study. Okay, so I want to introduce two studies by us. So first study is published 2 years ago in Journal of Marriage and Family, and it actually incorporates a more holistic approach by capitalizing on the 2013 PSID rosters and transfers module. So PSID is great, but I think the main PSID does not include the complete family members, right? So, for example, in-laws, where they live. So this module actually includes not just their own parents and their parents' in-laws, and also children and the children in-laws. So it's a very good data if you are interested in actually including all these extended family members. So I will introduce today that. And the second one is the study that published recently, the demographic research. This is for life course perspective. So we have a national estimate on the life course estimates on the family spatial proximity, parents and the children. And it also uses a very fine data in terms of granularity, block level location. That's what we are using. And the PSI, the main data, it's restricted information, but you can access under some user contract. So that's what we did, and we used that. And we follow 47 years from 1968, the children of 1968 until 2015. And we also incorporate some aspect of the mortality so that we can discuss the spatial availability aspect. Especially, this is important because, well, if you are interested in difference in the, across the groups, right, spatial availability and the mortality is really a huge variation across the socioeconomic and racial groups. Okay. So first paper I mentioned it again. It uses 2013 PSID, and including the rosters and transfers module as the main, and also we use the PSID, the main data. And the sample is age 25 and older, and their parents and their adult children. So here, when I say parents, that includes the parent-in-law, and when I say adult children, it also includes adult children-in-law. Okay. So key outcomes. We will look at the share of adults who have their nearest, closest parent or adult child at a given distance. And the second measure, the outcome is share of adults who have all parents or all adult children in a given distance. Okay, and we also looked at the differences across the social demographic and the geographic level. But today I will show you just one of that. Okay. So if we look at the nearest, what this says, the adults, percent of nearest parents within a given distance among those with a living parent. So we already restricted sample to adults who have at least one living parent, and almost 70% of them have co-resident or close by. So that's a very high probably, but that has been like that for a while. And we also have, measure, by the way, when I say close, that means actually 30 miles. That's the core point, okay? And the very far distance here, we use the 500 miles. But this actually, I must also admit that this distance is not really exact. We were using the centroid of city or village or town. So for this paper, we couldn't use the block level information because we had to use the information from the other RNT the data set, okay? And then, okay, how about nearest adult children? Then the parents, adults have about 76% at least, yes, the adult child living co-resident or close by, and about 7% very far, okay? How about all parents and all adult children? So we have here about 42% of adults. They have all parents in close proximity or co-resident. And about 39% of adults have all adult children within co-resident or close distance, okay? Okay, now let's talk about the difference across, in this case, by education. So we calculated this way. So the difference in the prevalence of co-resident or close. First, less than a lower education defined as less than 16 years of education minus the prevalence of higher education, which is 16 or greater years, and divided by 16 or greater years. So when you see the positive here number, that means those with lower education are more likely to live close to each other, okay? And you can see that actually we provided here the nearest and then all, and this shows that focusing on nearest relative probably understate the difference in proximity between low and high education, okay? And we also looked at actually how about 3 generations. So we added that, and so having family member, co-resident or close by, all family members, all children, and all parents, and the contrast is much bigger if we take into that account. Okay. Okay. The next topic here is next paper is about life course perspectives. Before we introduce, let me briefly talk about some background. So, okay, so spatial distance between parents and their adult children, there's a typo, I see that, influenced by life course events, right? And for example, going to college and entering labor market and family marriage and divorce and widowed, also having a child and the retirement and or health changes. All these will potentially affect the spatial distance because the distance, spatial proximity is a consequence of, in a way, the individual migration, and these are directly impacting on the migration. But at the same time, actually, the geographic proximity also plays a role, right, in as a kind of opportunity structure. So people plays actually a kind of instrumental role, right? So this distinctive life stage associated with this specific life course events would also influence the demand of child-parent proximity. Okay, so for example, among young adult children, the marriage and employment would be a very important motivation, and seeking higher education usually facilitate a long-distance move. And among the children, adult children who have their own children, they tend to live closer to their mothers, for example, so that they can also have some support in terms of child care and other aspects. In the later stage, it's the parents' health declines, and they also retire, and other aspects rise, and it might also affect their migration and spatial distance. Okay. So we used the data, the PSID, from 1968 to 2015. And the sample, the base sample, includes children aged under 18 living with biological and adoptive mother in 1968. So that is our base sample. And we also looked at two samples, I mean, this one and also including, so we basically followed actually their entire, like 47 years, right? So parents, the mother will pass away over the time, and we included two samples, regardless of mother pass away, that we keep them in the data. So we have additional proximity, which is mortality and death, and the other one is conditional on a mother living in a given year. Okay. So again, we measured the spatial distance based on block level location, and we used two different measures. The first, categorical measure, including 11 categories, which I will show just now, and semi-continuous measures also. So co-resident and the same block or not, and then beyond the block, we used it in miles. Okay. And we also looked at racial differences. So as you can see that here, initially, 100% they live with parents and the mother by construction. And then from about age 18 or around that time, they started now changing here. And the co-resident, it really dramatically decreases between, say, 18 and like 25. It used to be, from almost 100% now is 20-something percent, right? But if you look at, for example, 5 miles, it also decreases dramatically. Now it's about at age of 25, it's like about 55%. So, and age 35, it continued to decrease, but the co-resident is now, it's a little bit leveling off, right? And 45 and 55 to 64. So this has a lot, so I don't think we have time to really digest all the proximity, but you can see that actually 5 miles, this still, I mean, almost like a 20%. The distance is, is 5 miles. It's pretty close by, right? We are not focusing on now people with dementia or disability, but general population. And you can also see where the mother is alive, it dramatically changes over time. And at age 55 to 64, it's about like 50%. Yes?
Is this conditional on the mother being alive?
I'm sorry.
Is this conditional on the mother being alive?
No, this is not. So that's why mother is alive.
So from a caregiving perspective, that's not necessarily meaningful because for many of the distant
Well, that's, I mean, caregiving for mother, yes, that's exactly right, but the other way around, right? What about care, grandchild care or support from mother? I think that is, if you don't have mother and you don't receive the support. So, yes, depending on whose perspective, but that's what you said is actually right. So it has it included actually mother is alive, okay? But conditional on the mother alive in a given year. So, I think I'm not sure whether I said it correctly. So it's not conditional on the mother is alive. So it actually explicitly included whether mother is alive or not. So next one is conditional on whose mother alive in a given year, because this is what has been done most studies. So I mean, distance, that's usually how measured in the literature. So you can see the very kind of different once you drop those people, I mean, mother who died, then it's pretty much flat from about age 35 in terms of resident and the same block and all these pretty much. And here, I see even increasing slightly. So I was wondering whether they actually move closer to each other, not necessarily co-resident, maybe nearby. I haven't really focused on that particular part, but I've been always wondering whenever I see that, a little bit uptake. Any other question? Okay. So how about dynamic patterns? So I just showed you that there is a kind of static proximity, but it changes, right, over time. So the change in proximity, that must be affected by change in individual migration, and individual migration not necessarily always increasing the distance, right? They can move closer as well as they move further from each other. So we looked at also this dynamic patterns, okay, over the age. So you can see that actually, yes, the moving further from mother much higher than closer to mother. But I must say that actually moving closer to each other, it's also pretty high. This is the rate changed during the last 365. So we adjusted based on interview interval. And so this is what we have. Okay. Also, I want to clarify that father from mother, that does not mean they are moving, the children moving farther. It's actually, we don't know yet who is moving, but the proximity, in terms of proximity, it's moving farther from each other. But it is important to know whether children moving or whether mother is moving, right? So I think, yeah, a lot of people might think probably later years, maybe it's easier for mother to move because they are retired, and right? But probably it's not necessarily, and there's some evidence that it's not. And we also looked at, okay, by mover. So this is what we see here. So it's a pretty much dominant almost the entire life, of course, by child, the move by child only, I should have said that. And also, there's some change because of mother moved, I mean, only mother moved, and also both, but those are much lower in terms of, I mean, the rate relatively to child only move. So that's interesting. And the later age, we can see that it's pretty much similar, but until that point, it's very much dominated by adult child move. And the percent of closer proximity also is pretty much dominated by adult child move only. Okay. Yes?
Is there a minimum distance for the closer proximity? Because like moving from 3,000 miles away to 500 miles away might not make that big of a difference, but is there like a
Yes, that's a very good point, and we've been thinking a lot about it. So this one actually we used, I'm sorry that I didn't put it here. We used this measure, this categorical, because, so change in this rather than actually any distance, okay?
So it would capture 500 to 200 miles, even though that might not actually mean anything more for a caregiving relationship either way. 200 miles is specifically too hard to take care of my kids.
Right. Okay, any other question? Clarification or, okay. Yes?
So here, mother includes both mothers and mothers-in-law.
Not this one. Thank you for your question. This one is actually adoptive or biological mother. Okay, thank you. Yeah, I'm trying to actually introduce a lot, so I might be kind of missing a lot of detail here, so please feel free to interrupt for clarification. I really appreciate that. Thank you. Okay, how about racial differences? Before I share the estimate, let me provide some background. So in literature, Black people, they tend to move, in terms of individual level migration, they tend to move more frequently compared to white individuals. But Black individuals, they tend to live close to each other, I mean, parents and the children. And that difference is, I mean, if we think about small distance move versus a long distance move, small distance definitely African Americans, they tend to move more frequently. However, if we think about long distance move, is not necessarily, okay? And that's kind of important in terms of proximity. So despite that they move a lot, they tend to live close. And also, of course, the lower rate of home ownership, so they are more likely to be renters, so they tend to change residential locations more often. And also residential segregation and other sort of systemic, some public finance, the housing situation, they have a limited choice in terms of neighborhood. So the whole family and they tend to live sort of limited kind of areas, so that it tend to be the case, their proximity increases, right? I mean, that means that they tend to live closer to each other. And also Black people, they are more likely to do the return migration. So they move further, but also they move back. Okay? And one of the recent studies and looked at actually why this, there is this significant racial differences in terms of the proximity. And one of the important factors in terms of co-residence especially, it's a low rate of marriage among Black compared to white people, okay? And when we think about beyond co-residence, especially long distance, I mean, greater proximity, then education seems a very important factor explaining the racial difference in family proximity, okay? Also, we should think about health and mortality, the difference between Black and white people. It will also affect the preference and the need to be close to each other, right? And some studies also suggest that Black people, they have a stronger preference to be close to each other as well. Okay. So this is just median distance, and the sample we restricted to those with a mother alive in a given year. So you can see that actually the entire life course, African Americans, so the distance between mother and the child significantly smaller compared to white individuals. Okay. And we tested just to see what actually potentially influenced this one. And so negative, so it's basically we were testing this, but at a specific life stage. And you can see that the demographic adjustment, it didn't change much, but socioeconomic adjustment, it seems to significantly reduces the gap between Black individuals and white individuals. Okay, so this one is the share of adult children in a given proximity by age and race. So this one actually including, regardless of the mother died or not, the reason I'm showing this one, so when we think about, okay, spatial availability aspect, or less than or equal to 5 miles, then you can see that actually African Americans, they have a higher rate. That means they are more likely to live closer to each other and have, actually, I should say, more availability in some ways. But if we see actually 200 miles, but not necessarily because, mainly because of the mortality aspect. So that's why I was showing this one. Okay, the implication would be different if we take into account the mortality aspect. And this one is some estimates on the expected number of years. So based on multi-state life table, we calculated this one, and you can see that between age 18 and 54, so it's a total years, 36 years. Out of that, Black people, they spend about 9 years crescent with their mother, and the white people about 6.3 years with their mother. And it also, same block or less than 1 mile, and it's 5 years versus 4 years. And 5 miles also greater for Black people, but beyond that, we can see that white people, they have greater years. And the no living mother, so you can see that actually the Black people, they spend about 6.3 years out of the 36 years without mother, compared to 2.6 years of white people, okay, the years life. Okay, so then the next part of the talk, so it's now, okay, we looked at this family spatial proximity. So what is the implication focusing on this healthcare for older adults? So before we get to see the estimates, let me briefly share the disability in the US, because that is a very important part of the discussion. Actually, those with disability, meaning that having at least some limitation in vision, hearing, and mobility, and cognition, and self-care or independent living, actually it's not unusual. For example, there are 40% of people age 65 and older, they have a limitation in these. And it's also true that almost, many, in this case, 1 in 9 adults age 65 and older have dementia. So it's a lot of people think actually dementia is not really prevalent, but it is very prevalent, probably more than you may think. The thing is that baby boomers entering aging, and they're already entering, and 2 things, right? Actual number of people and also rate. And some disturbing trend is the rate of disability not improved. It was improving if we focusing on older people, say like 70s and older, but now I think it's changing. The recent middle-aged people, they tend to have a more, they're more likely to have also a disability. So this trend is kind of very disturbing. And one estimate says over 1 in 4 of current 20-year-olds is expected to be kind of disabled before reaching their normal retirement age, which is 67. And dementia, actually, it's expected to be double in a few decades. I think this is the trend, and it was about 6 million in 2020 and almost like 13 million in 2050. So it's very concerning. Okay, so what is the family role in this healthcare aspect for people, older adults? In fact, actually, families are the most common and important source of care for adults with disability. And statistics says 41 million family caregivers for people with a disability, and about 11 million providing care, unpaid care for people with dementia, okay, which is really substantial. And some studies suggest family caregivers may offset institutional care or delay transitioning to the institution, and also reduces some healthcare costs. And a recent paper says it is not just, it doesn't end in community setting. Actually, families continue to provide even in the nursing home facility, okay? I think that's very, very important to know that. And another aspect is actually when we think about older adults, especially those who with some disability and the dementia, actually they don't have, and many of them don't have actually the spouse. I know the spouse, if they have, spouse is the most important and the most, the primary caregiver, but unfortunately, actually, majority don't have a spouse, especially when we think about the people with the dementia. About actually 60% they do not. So you can see that actually adult children probably very important source for that. And then, you know, the spouses usually they live together, so maybe proximity is a less issue, although not necessarily, you know, spouses can, and one spouse, they might be in a nursing home and the other spouse not in community living. But when we, this spatial proximity, distance, more, I mean, the issue when we think about the adult child. And again, because these people with dementia and the disability, they do not have a spouse, this has become very important. I think, okay. So just to give you some idea about, okay, the sample is the adults with dementia and at least one ADL limitation. So they have a cognitive and physical kind of disability. And from their receiving, okay, from about 18% care received from spouse and about 23% they received from adult child. So adult child caregiving is more prevalent. So when we look at, I mean, all the caregiving, what about average total hours of help? If we look at only the positive hours, that means conditional on they provide or they receive the care, then you can see that actually spouse, the care hours much greater compared to adult child, right? It's a 245 versus 157. But if we include actually regardless of, without conditioning on actually receiving care, it's very comparable. So this is basically because of the rate is higher. Say that.
Per year, the hours per year, what's the time?
Oh, okay. This must be a month. Yes. Thank you. Okay. Any other question? All right. So how about the implication of a family spatial distance in care, health care for older adults with a disability? So close proximity from caregiver is significantly associated with a greater degree and the different types of care received among adults with a disability. So studies actually provide evidence that it actually affects not just the unpaid, the family care, also it affects paid care significantly. And the amount dramatically, decreases over distance. And actually, we also found, with the others, others found when there's a health shock or health decline, they actually move closer to each other. Okay. One of our early study, actually, we looked at the previously community dwelling and the newly disabled adults, age 55 and older, who have at least one adult child, and we looked at their kind of transition. And you can see that, within the community dwelling, the first two, the rate, so having the share of having at least one helper for the activities of daily living, it's 32%. If you have a co-resident adult child, but that decreases to 21% if all children live greater than 30 miles. Okay, and moving to a nursing home increases depending on the proximity to a child. And within actually people who received help, we also looked at actually whether they're receiving from that adult child and also the other former care. And you can see that it decreases kind of substantially over the proximity, the distance, right? And the former care increases, the receiving from the paid care increases as you have children living further.
But for those who have multiple children, you don't know whether somebody else is providing care. So this is not indicative of care not provided.
So this one is, so it's a kind of a aggregated in a way. So this distance is, based on closest children, but receiving care is actually not that particular child. It's aggregated. It's yes, again, thank you for the question. So this is actually the parents. They are the unit of analysis. So they have multiple children, right? So it's actually from the old children. And recent, yes.
Some of the children may live in different distances, right? So how does that work?
Right. So we have to summarize. So that's why we are focusing on actually nearest. So it is a kind of a
Nearest child.
yeah, nearest child. So this means actually all children they live further from 30 miles. Okay. So this was the sample is focusing on adults with activity limitation, but what about dementia specifically? So we did that, a similar.
Before we move on, just on this kind of question again, I guess ultimately one is concerned about care being provided, and arguably one could argue if you earn more by moving, I earn more by moving further away to the city, and then I can pay for care for my parents, versus staying in a rural area and providing it myself. So I guess I'm struggling with a bit with inferences to make from this, because if migration is associated with higher earnings, it might be that the parent is better off with children being far away, earning more, and providing, financially supporting higher quality care as compared to remaining close. A lot of what we're hearing is like less care being provided, and I'm pushing a little bit back and saying, can we infer that, or is it just differential care? Those are further away provide financial support.
Yes, that's actually very important aspect. All these and other, because care is I'm focusing on actually almost like hands-on care, right? Care with daily sort of activity. So it's pretty much a hands-on care, and it can be also surveillance kind of monitoring, but they have to physically, very close by. So it's probably more contingent on the spatial proximity. But other care as support aspect, like financial or emotional support, these are all very important part. But today I am not focusing on, but I am very much aware of that. That's very important, and we probably should expand, broader kind of aspect. So this is the reason we are focusing on, because the potential implication of this institutional care, the transition, that's why we are doing that. But I totally agree. That's a very, very interesting and important point. So yeah, focusing on dementia now, we also have a similar result. And this time, instead of 30 miles, we looked at 10 miles, because dementia, you need a higher level of kind of care, and we think 30 miles is too big, right? Okay, you can see that actually any informal helper, care received from any informal helper, it decreases if all adult children living 10 miles away or further than 10 miles, okay? And the care received from any child increases. You can see that actually if they quiescent especially. And the main distinction is actually really quiescent for these people with the dementia, okay? But this has, of course, a limitation. And the spatial, the location information is not that detailed, nothing like blood level. So we have like this 10 miles. And so it's not as detailed as the PSID, okay? So we are using the health and retirement study, which has really, we cannot do this study with the PSID, because we need all the other information about older people, and we need complete information about the children. Although we don't have a lot of information about children, at least they asked about older children. So that was very important. And this one is, okay, transitioning to a nursing home, and we can see that it has it's affected by I shouldn't say affected by, but significantly related, mainly the quiescent aspect, okay? I know I don't have a lot of time, so, but I think we are almost at the end here, and instead of actually summarizing, I want to end this talk with some discussion points about, as already brought out. I think there are many aspects that I haven't touched, but I think it's very important. So, okay, first, the close spatial proximity among family members, it definitely facilitates caregiving for aging parents with a disability. Then what does it mean by close proximity? We already kind of touched on this one, but I think it's still important to talk a little bit more about it. And another paper, it's really, it published just a few months ago, and we actually kind of replicated in a way that the early work by the 1987 paper, and we also found that this dramatic kind of decrease at the correction. By the way, we used the PSID for this one, and the sample is the parents with age 55 and who have at least one adult child and their children, okay? So it actually decreases between Korea and the same block and 2 miles and beyond 2 to 5 miles, we don't see really much differences here. And we used the quantile regression for this one, and we controlled the demographic differences and the severity of the ADL limitations. So that's I think it's a very important perspective. And another thing is, what about interaction, and not just parent and the child and nearest child? What about other family members? They might work together, right? Spouse and other child and siblings. So what about that? So this is a work in progress, and we looked at actually what happened at the onset of dementia, and the interesting thing is actually, okay, the spouse caregiver only actually it reduced. But we see actually one adult child caregiver only increased, and the multiple adult children, but no spouse care increased at the onset of dementia. But another thing is they already have at least one limitation activity, daily activity. Okay. And this one, so we also looked at percentage of moving to nursing home at the onset of dementia by spousal status and the proximity. And you can see that the rate, if they have a spouse and at least one child just prior to, at the baseline, then the rate of transitioning to nursing home is quite low, like 4%, as opposed to no spouse, but at least one child nearby, and no spouse, and all children live very far. And interestingly, these 3 groups, we don't see any difference. So what that means is these 3 groups, regardless of a spouse or adult child, if they have one person, it could be a spouse or one child, then actually it doesn't have much difference whether it's a spouse or adult child. So that was a thing. And okay. Again, promoting coresidence or close proximity probably is good for maybe parents and a broader kind of society, like probably it might save, right, health cost. But what about the potential adverse impact on adult children? And also the racial and ethnic or social demographic differences, right? Because it's a huge difference in terms of family care availability, the spouse especially, by race. And so this needs to be really taken into account also. Let me skip that because we don't have much time. Okay. And lastly, what about distance? We've been talking about really community setting, but you can see that actually a lot of people are still providing care, even in nursing home facility. So family members are still providing. So I think it's very interesting to know that, kind of choice of a nursing home location might be affected also depending on kind of the proximity aspect, and also in the aspect of a family care environment at a nursing home. I think it might be also depending on where they live, how far from the nursing home, right? I think these are very, important, and we've been working on it, but I want to see more people working on this area. Okay, I think that's it. Thank you.